Yes, thank you, Bob. Thank you for that presentation, and thanks to all panelists. Before we go into the Q&A session, I will launch the poll about the webinar itself, so you can give us, as attendees, your feedback and your feelings about the quality of the webinar. So you have a few seconds for that. My personal takeaways from what we've heard today is that on one side, technology can offer a lot of solutions from different aspects, from different industries, but there is no single solution. The reality will probably be a mixture of different products, different technologies, and it's not only about managing and measuring, and data will help, but it's also about reinstalling confidence into travel. It's not only about the efficiency of the measures, but it's also about the feeling of the passengers and how they will feel and be safe again flying. Okay, we have votes coming in from the poll, but I will leave it running still for a few minutes and go into the Q&A. I think the first question is going to Anna and relates to the table you presented with the effectiveness of the different measures. And that's quite an interesting question. How do you define effective in that context? What is an effective measure, and how do you define effectiveness? Anna?
Thank you, Vincent. Yes, it's a very good question. So there are different ways that we measure effectiveness. I guess we define effectiveness. So it could be minimizing the risk of transmission. So that's the cleaning protocols, implementing the HVAC system, upgrades, those sorts of measures. Effectiveness could also be about detecting the virus, the presence of the virus in a person. And so that those measures could deal with, testing or the thermal screening, or is an ineffectiveness in this case on its own. Also effectiveness could be about information. So communication to passengers to inform them of what they need to do, hygiene kind of measures, but also what they have to expect when they arrive at the airport, the wearing of the mask, so that they are prepared and they are compliant. Thank you.
Thank you, Anna. The second question was raised during Lee's presentation, but it's quite general. So if someone else wants to pick it up, because it's a hard one. Given the current increase of new COVID cases in various countries, UK, Spain, Germany, Italy, and France, what could be the possible impacts to the airports industries in terms of travel restrictions? Lee, please.
Yeah, it's a huge dilemma, I think. I think, as I was outlining before, whilst we're seeing those cases rise, and they have been rising over the last few days, it's a very near-term phenomenon, is that we're not seeing the deaths increase to the same level that we saw back in March, and I'm sure there's a whole sort of gamut of reasons behind that. I think the challenge for the government now is it's much more focused on the economic impact than it perhaps may have been earlier in the year, and it understands that locking down and applying restrictions everywhere is unaffordable and is in danger of bankrupting the globe if we're not careful. So I think if there will certainly be some impact to confidence for sure for travellers, but I think if we don't see an increase in the level of people dying from COVID over the coming few weeks, then governments will feel they'll less need to be on the side of caution, and maybe will allow to lessen quarantines. I read in the paper this morning about some quarantines reducing to 7 days, and perhaps we'll see that across Europe.
Thank you,
I'm not sure if anyone else wanted to.
Any other comments from the panel? Okay, then we'll move to the next questions. One was specifically to Megan. What is your take on drop-off points outside terminal airports? Could it help and make queues more manageable?
Yeah, thanks for the question. I think definitely, you know, any opportunity to, you know, have travelers do a lot of their kind of passenger or procedures outside of the terminal is great. I think, you know, when you talk about curbside check-in, I think they're great for families. I think they, you know, were quite prominent many years ago before we had this self kind of service check-in, which that took over. And I think people are more inclined to want to use that or go inside to the airport. But I think they could definitely help. And I think, you know, when it comes down to, you know, handling check-in, I think that's a really good use case. But then you get to, you know, security and going through the security checkpoint. So I think, you know, that will definitely help check in, but then everyone has to go through the screening area. So it's still kind of an area that, you know, we need help with to manage.
Thank you, Megan. The next question will be for Bob. You mentioned that temperature checks are not so effective, and you went briefly into vital sign checking. What is it? What do you suggest here, and can it be more effective than temperature checks?
Yeah, thanks, Vincent. Yeah, I guess, you know, there's been a lot in the media about the accuracy and the value of temperature checks. And what we've seen is by using the handheld scanner gun and pointing at someone's face, you really don't get an accurate measurement of people's temperature. And in Alenium, we've spent a lot of time and resource in trying to understand how to measure people's temperature accurately. And we've developed the technology, and we're not the only ones who've developed the technology that can be as accurate as the sort of industry standard in the ear thermometer. So that's the first element, is the getting the accuracy of the measurement. The other thing is studies have shown that in detecting symptoms of illness, temperature alone is about 40% accurate in predicting an illness. Whereas if you add in temperature, heart rate, and respiratory rate, you get about a 90% prediction if someone could be sick or not. So that's why we encourage not just to look at the temperature checking, but also checking of other vital signs such as heart rate and respiratory rate, and to do that in a non-contact, touchless and automated way.
Okay, thank you, Bob, for that. We have another question which is quite interesting, but not addressed to a specific panelist. What about younger passengers, children, teenagers, which probably need a different kind of solutions and processing here? Anybody?
I mean, I'll just throw out a comment as I'm the only one who's not muted. You know, I guess it depends on from the technology point of view. You know, once kids go above a certain age, they're the same size more or less as adults, and below a certain age, certainly I've got school-going kids, and the general view is that kids can't transmit the virus between themselves. So I think the answer on kids, and the answer also in terms of the you know, maybe the earlier question with the spike in cases in certain countries in Europe is, you know, we do need industry-wide guidance and decision. It's extremely difficult for each airport on their own to make a decision, for example, on how to deal with a child. At what age are you no longer a child? How should they be processed differently? And at a certain point, we do need an industry-wide collaboration and guidance on how to deal with these sorts of issues and questions.
And sorry, can I add to that? That's a very good point, Bob. Yes, the industry collaboration is the key here, not just for young travelers, but for pretty much everything. And that's why industry organizations such as IATA and ACI have tried really hard in the last even few days and few weeks to get the industry to work together. And ICAO has done also a tremendous job in trying to have these discussions with governments so that there is an increased emphasis on protocols, standardized protocols that are adopted everywhere, and that will therefore avoid some of these very stringent travel restrictions.
Thank you, Anna. There is one more question coming in to you. You referred biometrics and touchless as an opportunity and something that can help with COVID mitigation. But the people asking the question say they've seen seamless travel and they still see queues. So do you really think biometric and touchless can help in COVID and really reduce queues?
Yes, I did mention biometrics and touchless. Touchless is definitely the first step towards avoiding basically the spreading of the virus. But biometrics really pushed to its maximum capabilities, which means also incorporating digital understanding or digital record of passport and immunization. And it's something that is very much debated also on the privacy level. But there's a lot of discussion also on how this information can be the hands of the travelers and only shared with whoever they're interacting at that specific touch point on a kind of, is a choice that the passengers will make about what information to share and when. But basically by enabling the passengers to just have this information digitally available and digitally shared, you can envision a journey through processing points that is basically touchless, completely touchless, and just using your face, for example, as your identity. And the other thing that this kind of technology does has been proven by all the testing done all over the world, in various airports all over the world, that the processing is faster, the queues are smaller, and in some cases, touch points can be combined. So there are fewer touch points, for example, immigration and boarding, kiosks, check-in kiosks will not be no longer required in such an extensive deployment, check-in counters. So again, technology that will reduce the number of touch points, the few that are remain will be touchless, in a way where information can be combined and digitalized and be in the hands of the passenger himself or herself to share when needed. So there's a lot of work to be done. We're not there yet by any means, but I think there is a big push now within regulators and airports, airlines to make this happen as soon as possible.
Thank you, Anna. The next question is for Megan. You mentioned how you can measure social distancing. The question is about knowing if you can give some examples from your experience at airports you work with. What the measures are or what measures can be put in place to improve social distancing?
Sure. So yeah, just one example, one of our customers, what they're actually doing is with the PDI, what they've done is they've set a threshold. So, when the PDI hits a certain number, a notification actually goes out. And we have this airport has a good working relationship with the TSA. So the TSA supervisor is actually getting a notification, as well as one of the terminal operations supervisors. So when the PDI hits that number, they're actually being sent out to the floor to kind of mitigate the issues. Another way it can help, again, is with queue layout. So looking and determining, if the stanchions need to move, that's just, one example. But really it's about having that insight and if you need to either set up notifications or alarms or change the layouts, can be really helpful there.
Thank you, Megan. The next question is specifically addressed to Bob. Aviation is not the only transportation industry that needs hash reboots. What can aviation learn from other transportation modes, or are there other transportation modes that can learn from aviation?
Yeah, thanks for the question, Florian. It's funny, my background is in aviation, and recently, because of Liam's development of the technology for the health check, I've kind of gotten out of the aviation sector to an extent. So talking to other transportation providers and organizations, and also just industry in general. And that question I get asked a lot. I think, you know, what's kind of unique about aviation in terms of passenger flow is the volume of people that you get flowing through an airport or a particular space at a point in time. There's no other real parallel. So like an entrance to a shopping mall or an entrance to a hospital, for example, you never get that same flow rate. Arguably, you get a similar flow rate with rail. Rail is a little bit different because you get a much higher transaction volume, whereas people who travel on a flight, generally you spend more time going through the individual touch points. But certainly I think on you know, the technology such as touchless technology and any kind of health screening that we can do as part of the passenger journey could very much be applicable to things like shopping malls, but also sports stadiums. The sporting industry and the event industry in general are also really struggling. And typically those industries don't have access to the technology that we do here. So I do see a room for us to take the lessons that we learn here in terms of applying things like touchless and health checking technology in aviation, and applying that to things like events, such as sporting events or concerts and that sort of thing.
Thank you, Bob. The next question is about the rapid antigen tests and their link to the lack of confidence that we have. Could antigen tests be really the solution to increase passengers' confidence and agreements between countries to trust each other? Does someone want to go on that?
Yeah, I can try. And I know that Bob had a whole slide on testing, so maybe he also wants to add to it. But yeah, so basically the position of ACI and IATA is to support antigen testing as the way to go, rapid antigen testing as the way to go. And recently they wrote to the European Commission and independently to other states to basically adopt this as the new standard for testing. Some airports have already started it. I think there were trials on some flights and at Milan Malpensa and Fiumicino airports in Italy. So the problem with this test at the moment is that, as Bob said before, it's not it's not super accurate. So there are still cases where the passenger is not showing any of the anti-agents or agents present for this virus to be detected, even though they will become, let's say, COVID positive. So, and I'm not an health expert, as you can tell, but reading the literature and talking to people in the industry and yeah, just listening to what's going on out there, countries are still not on board with antigen testing, but hopefully the view is that they will as testing continues to improve.
Thank you, Anna. We are close to the end, but I think we have time for one more question. We have one for Megan about the mask detection feature you've shown in the video. And it's a bit multifaceted question. Does that imply facial recognition with all the possible privacy aspects of it? And second, how can you enforce it in reality? I mean, you detect someone has no mask. What do you do next?
Yeah, good question. So our face mask detection does not require facial recognition. So it's our AI firmware, which actually mimics the human eye. So we've trained the AI to visually distinguish if an individual is wearing a face mask or not. So it's more about the properties of the mask, the shape, where it is on the face. As for enforcing it, yeah, it's tough. I mean, you know, the face mask detection and enforcement's only as successful as you make it. So, you know, I think it's tricky here, especially in the States. You know, many people can choose not to wear a mask. And if they have certain ailments that prevent them from wearing ones, it's very difficult to enforce. But I think it goes back to human behavior. I think the majority of us tend to want to follow the rules. And in a space like an airport where I think everyone really, you know, primarily wants to be safe as possible. And I think most of them are following suit. So if others are wearing masks, you know, they'll typically also wear one. But yeah, it's hard to enforce, definitely.
Thank you, Megan. So we've got the results of the polls coming in now. So just looking at that, with between 25% judging the webinar excellent and 58% judging it good. So thank you for that. It has been recorded, so the recording will be available. You will all receive a link in the end. We will do our best to answer the still open questions. But I want to thank all the participants today for your presentation and for answering and taking time to interact with everybody. I encourage you to check Reboot Aviation online on their website and on LinkedIn. So if someone wants to add some last words, please. Otherwise, we are on time. So thank you, everybody, and hopefully see you soon for our next Reboot Aviation webinar. Bye.
Thank you.
Thanks, everyone.
Thank you.